Okay, so what I'm going to cover today are topics that are going to include traditional Chinese medicine interventions, nutritional support, exercise and lifestyle suggestions, Western and Chinese herbalism, and supplements for common conditions affecting women, including menstruation issues, PMS, infertility, pregnancy and postpartum support, menopause, chronic fatigue, breast cancer. I'll also be speaking briefly about weight loss and appetite control and a natural approach to anti aging. Okay, and before I start, a disclaimer for women who are pregnant, breastfeeding, or have hormone sensitive conditions. They need to exercise caution and consult with a healthcare professional before starting any herbal supplement or herbal formula mentioned in this webinar. Um, Although herbs are great, they're not always helpful for everyone. What could help one person can harm another person. And also, the right herb for the right person in the wrong dose can also be harmful. So, just speak with your certified nutritionist, herbalist, or acupuncture physician before starting any of these supplements or herbal regimens. A brief introduction to me. I am the host of this webinar today. I'm Dr. Larissa Smith, also known as Dr. Lara. I'm an acupuncture physician, a doctor of Oriental medicine. I've had a lifelong interest in natural remedies. I studied herbalism at the Traditions School of Herbal Studies in St. Pete prior to enrolling in acupuncture school at East West College of Natural Medicine in Sarasota. Um, I obtained my master's in Oriental medicine and bachelor's degree in professional health sciences. I'm the owner and operator of Golden Phoenix Acupuncture and Wellness, located in Vibrant Wellbeing Center in Northeast St. Pete. It's a hybrid clinic. I offer private session treatments and community style acupuncture, which makes acupuncture accessible to everyone in the community who needs it. Because when pain and chronic disease and stress get in the way of you living your very best possible life, Golden Phoenix Acupuncture and Wellness uses natural drug-free healing and gets to the root cause of your symptoms, providing real lasting relief so that you can reclaim your health and happiness. I love helping people use natural medicine to overcome pain and chronic disease. And I'm really excited about speaking to you today about how natural medicine can help women's health. And traditional Chinese medicine is exceptionally great at treating issues that women experience. So I hope that this presentation will introduce some new ideas and information to you that you can use and also share with your friends and family. So in traditional Chinese medicine theory, we see the female life cycles in cycles of 7 years. And for males, it's cycles of 8 years. And the organs that are central to female reproductive physiology and pathology are the liver, the spleen, and the kidney. And I've listed here the main treatment principles used in traditional Chinese medicine. I won't read them off to you, but this is just to show you that there's many different differential diagnoses for women's conditions, and each one has a different approach with point prescriptions and herbal formula recommendations. So acupuncture and herbal medicine create balance, smooth the free flow of liver qi to relieve irritability and regulate menses, nourish the blood and tonify blood deficiency, invigorate blood to relieve blood stagnation that cause severe period pains. Acupuncture affects the nervous system, the circulatory system, fascial system, and endocrine system. And I'm also a big proponent of using food as medicine. Starting off with the very first topic in menstrual health is dysmenorrhea. So the average menstrual cycle is 28 days long, in duration, every 28 days. And then the menses cycle lasts from 3 to 7 days. So, what is normal? Um, what some people consider normal may not actually be normal. Painful cramping, large clots that are bigger than the tip of your pinky are not normal. You don't have to suffer through periods with debilitating headaches, cramps. Um, these are all things that we can address with acupuncture, herbal medicine, food therapy, exercise, to get you back into balance and to be pain free, which is normal. So, one in five women are experience menorrhagia, which is basically heavy menstrual flow lasting more than 7 days with severe cramping. So, diet, I'm going to recommend not to eat a lot of dairy products because dairy products tend to create what we call dampness in the body. Abstaining from dairy, or at least reducing or stopping consuming dairy at least 1 week before the menstrual cycle begins, is going to be beneficial. If you experience a lot of bloating and fatigue, I would recommend not to eat a raw vegetable diet, including salads, smoothies. Um, Opt more for eating cooked foods, warming things to help with the digestive system to reduce those symptoms. Using a castor oil pack with heat is going to be beneficial. And how to do that is basically you just apply castor oil on the low abdomen. You can apply a thin layer of gauze and then saran wrap, and then put a heat source on top of that, either a heating pad or hot towel. Um, and do this before and during the menstrual cycle to reduce blood stagnation and pain. Castor oil penetrates the dermal layer of skin deeper than any other type of oil. And you can also use that as a carrier oil for other essential oils that are going to be beneficial, such as clary sage. It's great for menstrual cramps due to its antispasmodic properties. It helps relax the muscles in the uterus and relieve pain. Rosemary oil is believed to have muscle relaxing properties that can help relieve menstrual cramps. And geranium oil has been used to balance hormones and reduce menstrual discomfort. Diluting a few drops in a carrier oil, massage to your low abdomen, and you can do it with a castor oil. So, herbal supplements that I would recommend for dysmenorrhea are going to be vitamin K because it helps with normal blood clotting. Alfalfa is a really good source of vitamin K. Vitamin E, it's a fat soluble vitamin and it's antioxidants. It's been studied in relation to certain hormone related conditions like polycystic ovarian syndrome and endometriosis. Essential fatty acids are going to be good for you. Black haw is a herb that's been traditionally used to relieve menstrual cramps and discomfort. It's got antispasmodic properties that help relax the uterine muscles. Black cohosh has an estrogen effect. Lady's mantle, it's an herb that's believed to have a toning and astringent property that can benefit the uterus. Also good for digestive health. Go to cola, false unicorn root, pau de arco. This is actually a bark from a South American tree. It's got antioxidant, antimicrobial, and anti-inflammatory benefits. DMG is dimethylglycine. It's a compound that usually occurs naturally in the body, and it can also be consumed as a dietary supplement. It increases oxygen and blood flow to the organs, and DMG is suggested to have adaptogenic properties. That just means that it can help your body adapt to stress and support your emotional well-being. And there's two hepatoprotective herbs. That just means they're going to support your liver health and function. The first one, it's going to be dandelion root. It's great for digestive health also, and it can be a diuretic, which can be particularly beneficial for women who experience water retention and bloating during certain times of their menstrual cycle. Milk thistle. It also helps protect liver cells from damage, promote liver cell regeneration, and support your overall liver function. So the next topic I'm going to talk about is amenorrhea, which is just the absence of menstruation in women of reproductive age, caused by various things such as a hormonal imbalance or overstressed, too much exercise, or PCOS, just to name a few. Herbal supplements, fennel oil, essential oil of fennel. It's known for its estrogen-like properties. It can help stimulate hormone production and promote menstruation. You can dilute a few drops of that in a carrier oil and massage it on your low abdomen or add it to a warm bath. Natural estrogen-containing herbs are going to be anise, dangguai, that's the Chinese herb, fennel, fenugreek, ginseng, licorice root, red clover, sage, suma, which is also known as Brazilian ginseng, and wild yam. Endometriosis is a condition that causes severe pelvic pain and irregular menstrual cycle. In the United States, more than 6.5 million women have been diagnosed with endometriosis, and this is roughly 1 in 10 women of reproductive age. And for many, the pain can be debilitating. Others can experience what's called silent endometriosis, in which there's never any pain experienced. And many of those women are not diagnosed until they undergo surgery for some other condition or have exploratory surgery. The good news is that this can be treated using acupuncture to regulate hormones, release endorphins, and to reduce the proliferation of the endometrial tissue where it shouldn't be, due to what we call blood stagnation in Chinese medicine. We can also reduce pain and inflammation. So the acupuncture and herbal medicine are going to be great at just creating balance, smoothing that flow of qi. We don't want to have any stagnation of qi and blood because that will equal pain. Some diet and lifestyle advice for endometriosis. Some women find that certain dietary changes can help alleviate symptoms. You can consider eliminating inflammatory foods like processed foods, refined sugars, refined flour products, caffeine, or alcohol. Focus more on a balanced diet rich in fresh fruits and vegetables, whole grains, lean proteins, and healthy fats. Eliminate foods like dairy products, greasy, fatty, and spicy foods. Dairy products can have added hormones and antibiotics. Plus, if you're sensitive to dairy products, that can create inflammation in your body. So the greasy and fatty foods are going to require bile to break down and digest, which is made by your liver and can be taxing on the liver. And the spicy foods, they can create more heat in the body, which can exacerbate symptoms. Some women try different approaches like the elimination diet, which isn't for everyone. Also, a 50% raw vegetable diet may be beneficial for some people, a gluten-free or a dairy-free diet. Consuming iodine-rich foods. Iodine helps balance estrogen levels by blocking the receptors, so you're not estrogen dominant. Good sources of iodine in the diet: seaweed or sea kelp, codfish, shrimp, eggs. Avoiding using table salt for your source of iodine. Consuming dark leafy greens, green drinks. You can try fasting for 3 days before your menses, increase fiber in your diet. Of course, regular exercise can help reduce pain, improve its circulation, and promote overall well being. Low impact activities like yoga, swimming, or walking are great. Chronic stress can really make symptoms worse. So, it's important to incorporate stress management techniques in your daily life, like meditation, breathing exercises, doing things, activities, hobbies that bring you joy and relaxation are going to be beneficial for you. Herbs and supplements I recommend. So, to support hormonal balance and reduce inflammation, turmeric, ginger, chasteberry, and evening primrose oil, essential fatty acids, calcium, magnesium for cramps. Beet kvass and nettles are a great source of iron. And keep in mind that vitamin C plays a role in iron absorption in the body. So it enhances the absorption of a non-heme oil, which non-heme iron, which is the type of iron found in plant-based foods and iron supplements. All right, PMS is our next topic, and it's a complex mixture of physical and psychological conditions whose causes are still not completely understood by biomedical reasoning. Approximately 40% of women experience it, and approximately 2 to 3% experience severe symptoms known as PMDD, or premenstrual dysphoric disorder. You can think of this like the difference between a headache and a migraine. And there's some thoughts that the phases of the moon affect our body. I listened to a webinar recently from Dr. Michelle Hamilton. She's an acupuncturist in California. She has a whole course that she's created just based on what she calls lunar acupuncture. The different phases of the moon affect the body in different ways, and different treatment approaches using acupuncture during each moon phase. It's really interesting. Some diet and lifestyle advice for PMS. If you have a lot of moodiness, consuming sour foods, because sour is the flavor associated with the liver in Chinese medicine, and it's used in food therapy to relieve irritability. So drinking lemon water or apple cider vinegar water daily will help. Limes, grapefruits, sauerkraut, green apples, those are all good sour foods. Pickles. If you're experiencing bloating and fatigue, try eating more cooked foods and avoiding the raw, cold foods such as salads and smoothies and ice cold beverages. Aerobic exercise increases blood flow, releases endorphins, which can improve your mood and reduce pain. So brisk walking, jogging, cycling, swimming, or dancing are going to be great. Belly dancing is a really great full body workout, and it's just a lot of fun. Yoga, Pilates, and stretching are also beneficial. And remember to regularly exercise, because consistency is the key. So aim for at least 30 minutes of moderate intensity exercise most days of the week. Herbs and supplements that are going to help with PMS are acidophilus, because the gut microbiome plays a crucial role in various bodily functions, including hormone metabolism and immune system regulation. A healthy gut can support optimal hormone production and metabolism, potentially influencing PMS symptoms. And you can start with just a basic probiotic supplement. It doesn't have to be the supplement that's the most expensive on the shelf or the one with the most numbers. It can just be, you can just start with a basic one, and that's fine. Some studies suggests that calcium supplementation can also help alleviate PMS symptoms. Magnesium is great for cramps and mood swings and bloating because it relaxes muscles. Depression, moodiness, and sadness can be helped with these supplements. So 5-HTP is a naturally occurring compound produced in the body from an amino acid called tryptophan. So it serves as a precursor to serotonin, which is a neurotransmitter involved in regulating your mood, sleep, and appetite. Vitamin D is going to be good. According to the CDC, 8% of the US population is at risk for vitamin D deficiency. And the dosage for women should be about 5,000 IUs daily. Some adaptogens. Adaptogens are things that just help the body adapt and respond better to stressors, both physical and mental. Ashwagandha is an Ayurvedic adaptogen herb. I use this one myself and I love it. And cat's claw is another one. I misspelled it here. It's actually cat's claw, not cats. All right. So the next topic is going to be infertility. So female infertility is the inability to conceive after 1 year of unprotected intercourse. It affects about 8 to 12% of couples globally. And 7.3 million American women of reproductive age are affected with fertility issues, mostly from ovulatory failure or defect. And egg quality can be improved with diet and lifestyle improvements, herbal medicine, and acupuncture. So what are the possible causes of infertility? Chronic stress, chronic disease is a big cause because your body is going to shut down accessory processes to take care of other areas in crisis. When your sympathetic fight or flight mode is turned on all the time due to chronic stress, it's really going to affect your fertility. A red flag is going to be, like I mentioned before, menstrual clots larger than the tip of your pinky. So prior abdominal surgery, psychological issues. The patient or the woman may say that she wants to get pregnant, but she really doesn't. Being too thin, eating too much fast food, poor diet, not exercising, anemia, blocked fallopian tubes, polyps, radiation. I recommend keeping your phone or your laptop off of your lap because that could affect be one of the things that's affecting your fertility. Lymph system stagnation. So getting a lymph massage is going to help you, and avoiding perfume just for the time being that you're trying to get pregnant, because perfume can be a hormone disruptor. And also something in Chinese medicine that we call cold in the uterus. There's certain acupuncture channels. One is called the kidney channel. It has a point on the bottom of the foot called kidney 1. It's an entry point of the channel, and it goes through the reproductive areas. So keeping your feet warm, wearing socks, not sitting on cold surfaces are going to be beneficial to avoid getting cold in the uterus, as we call it. Some TCM treatments that are great. So moxibustion and acupuncture. So moxibustion is the burning of an herb called mugwort. It's an herb that has a therapeutic property, not just from its heat, because we burn it over specific acupoints over the skin. It's just a warming effect. It's going to help with tonifying. It's used hand in hand with acupuncture quite frequently for infertility and also for digestive issues. Telling you a little bit about a personal story of mine. my husband and I were trying for our second child for about 9 months before actually getting pregnant. So this was the last 2 semesters of acupuncture school, and it was really stressful for me. A stressful time in my life. Really wanted to get pregnant, but just wasn't able to. Um, and acupuncture school is really um, it takes a lot. Took a lot out of me. I was really stressed, studying a lot, not getting a lot of sleep. And literally 2 weeks after I graduated from acupuncture school, we had a positive pregnancy test. So, um, shows you how stress can really affect your life and your fertility. So, acupuncture and herbs are something that you can add as well as stress relieving things like prenatal massage. Um, you really want to start preparing the body 3 months before actually starting to try to conceive, because it helps build up your strength, and especially important to start taking prenatal vitamins 3 months before starting to try to become pregnant or before beginning IVF treatments. Some diet and lifestyle advice for infertility. First question I would ask is, what type of water are you drinking? So there's some studies that show our tap water contains trace amounts of man-made chemicals and pharmaceutical medications, including estrogen, which is inadvertently released into our sewer systems through the urine of women who take birth control. So some researchers argue that such trace amounts don't do any harm. Others beg to differ, stating that there's scientific evidence that even extremely diluted concentrations of drug residues harm fish, frogs, and other aquatic species, and have been shown in labs to impair human cell function. A solution to this is going to be having a reverse osmosis filtration system and carbon filtered water. Avoid using plastic water bottles, opting for glass or stainless steel materials. Avoid cold, icy beverages, ice cream, and like I mentioned before, walking on the cold ground with bare feet on cold floors. A diet including whole grains and complex carbs, like quinoa, brown rice, and whole wheat. Complex carbs, such as sweet potatoes and lentils. Consume foods high in folate, like leafy greens, citrus fruits, legumes, and fortified grains. Include sources of omega-3 fatty acids in the diet that help support hormone production and reproductive health in general. So fatty fish like salmon and sardines, also flax seeds, chia seeds, and walnuts. Eat healthy fats like avocado, olive oil, and nuts. Black cod, um, it's got a tonifying property. It can help strengthen uterine muscles. Manganese is an essential mineral, and it helps play a role in women's health. It can help in the production and regulation of reproductive hormones. Um, and also, are you exercising too much? If you're, doing spin cycle classes 6 days a week, or if you're, preparing your body for a marathon or an Ironman competition, you kind of need to back off of exercising too much, because that could also be a potential cause for infertility as well. Some helpful herbs and supplements for infertility: wild yam root. It's been known to enhance sexual function in women. False unicorn root, maca. It can help regulate menstrual cycles and support reproductive health. Dang guai, it's a Chinese herb. It's also referred to as female ginseng. It can help regulate your menstrual cycle, promote blood flow to the uterus. Also, Chinese peony, it's used to support hormone balance and regulate the menstrual cycle. Brahmania is a commonly used herb in traditional Chinese medicine to nourish what we call yin energy and support the kidneys and reproductive system. Astragalus is an immune enhancing herb that can help to support fertility. Eucomia bark, it's known for its potential to strengthen bones and connective tissue. So it can be used to support fertility and pregnancy by promoting a healthy reproductive system. So in pregnancy, you're going to want to use acupuncture and herbal medicine. You can use that throughout the whole pregnancy to help support pregnancy and prevent miscarriage. And you want to ensure blood pressure is not too low or too high. Preeclampsia is a condition affecting 2 to 8% of US women. You want to limit your sodium intake and increase your potassium and stay hydrated. Avoiding processed and packaged foods that are typically really high in sodium content, and opt more for whole foods that you prepare at home. Potassium rich foods can help counterbalance the effect of sodium, and that can help lower your blood pressure. Foods such as bananas, sweet potatoes, spinach, avocados, and white beans are going to be beneficial. Another thing that affects pregnancy is gestational diabetes. It occurs in 6 to 9% of pregnancies. And the danger of gestational diabetes is that the baby can be born overweight, and then the mother will be at risk for getting type 2 diabetes after the child is born. Chromium picolinate is a supplement that is going to be safe to take if you fail your initial glucose test, which is provided by your OBGYN provider. This is a test to see if you have gestational diabetes. So if that test, you end up failing that test, chromium picolinate should be taken approximately 500 milligrams to 1,000 milligrams per day, every day until the second 3-hour glucose test. It's going to help regulate your blood sugar so that you don't fail that second glucose test. And you can continue to take chromium picolinate throughout pregnancy, and you can take it occasionally as a preventative after the baby is born. Consuming iron-rich foods, red meat, of course, poultry, darker meat has a higher iron content, seafood, and if you're feeling adventurous, organ meats, which is not my cup of tea, but organ meats is a great source of iron. Legumes, dark leafy greens, and nuts and seeds like pumpkin seeds, sesame seeds, hemp seeds, cashews, and almonds, tofu, tempeh, and dried fruits like raisins, apricots, prunes, and dates. And remember that your body's ability to absorb iron from plant-based sources can be enhanced by consuming vitamin C rich foods like citrus, bell peppers, strawberries, and tomatoes. And in the third trimester, definitely try to eat enough protein, about 75 to 100 grams per day. And raspberry leaf tea in the last half or the third trimester of pregnancy helps relax the uterine muscles and strengthen the uterus. Eating fresh versus canned fruits and vegetables is going to be ideal. Acupuncture and herbs are used to raise your chi to prevent miscarriage, and are going to do what we call calming the fetus. So when we use acupuncture and herbs to calm the fetus, it's used when there's spotting during pregnancy to help prevent miscarriage by raising chi. Also important to relieve stress. Acupuncture is great at relieving stress and nausea, which is commonly experienced with pregnancy. Prenatal massage is also something great for stress reduction during pregnancy. And I highly recommend, especially first-time moms, getting a doula. A doula is going to help you basically be your coach through pregnancy, labor, and delivery. Really great to have at your side when you're going through that whole process to make sure that everyone is respecting your birth plan, whether you have, whether in a hospital or having a home birth or at a birthing center. Getting a doula is really important. And there's some doulas out there who are both acupuncturists and doulas, which is kind of a really good combination. So some herbs and supplements I'll recommend for pregnancy. Of course, ginger is great for nausea. Quercetin is good for circulation. It's also a good supplement for allergy symptoms. Acidophilus is great. Floridex, it's a liquid iron supplement that's vegan friendly. Calcium and potassium are good for cramps. When looking at getting a prenatal vitamin, you want to choose carefully. Try to opt for organic and something that's GMP certified. That just means good manufacturing practices. And take a look at what type of folate or vitamin B9 is in your prenatal. This is really important because folate is a building block for DNA synthesis and prevents birth defects. You want to start taking a prenatal vitamin 3 months before trying to get pregnant. There's research that shows women who consume the synthetic type of folate called folic acid to support fertility or for pregnancy may not actually be lowering their risk of birth defects or miscarriage. Folic acid is a cheap, inexpensive form of B9, but it has a low bioavailability, which just means how usable it is by your body. Folic acid is commonly used in dietary supplements and fortified foods. So folate has a lot of different names. It can be a little confusing, but you want to opt for a type of folate that is bioactive. Bioactive forms of folate raise blood levels of folate more effectively than folic acid. And folinic acid is good for those who are sensitive to methylation. Next topic I'll speak about is the labor, delivery, and postpartum. Just starting with a few statistics here. So only 5% of women actually give birth on their due date. So if you go past your due date, don't stress it. The baby's going to come when it's ready to come. In the US, there's a 40 to 50% of births are induced, and there's a 32% C-section rate. This is 2 to 3 times more than the rest of the world, which is really, really too high. Going back to the 1970s in the US, the C-section rate was only between 7 and 12%. And what's kind of scary is that the US is ranked #1 among all developed countries for maternal mortality rate. So to me, that's a huge red flag for a sign of public health neglect. And the US is really the only industrialized nation in the world where that maternal mortality rate continues to rise. I listened to a webinar a few months ago that was hosted by an acupuncturist in California. Her name's Dr. Deb Davies. She said something interesting. She said that in Israel, they only have a rate of 3 deaths per 100,000 live births, which is significantly much less than the United States. So what are they doing differently in the hospitals in Israel? Every hospital in Israel has a department for acupuncture. So that's just one of the defining differences. So it goes to show how powerful acupuncture can be in supporting labor and delivery. So how can we promote labor and delivery? So moxa or moxibustion, like I mentioned before, is useful whenever the baby is in the wrong position. It's called breech. There's a point on the foot that actually will help to turn a breech baby, a specific point on the foot. So moxibustion is used at a specific time, usually between weeks 33 and 36, to turn a breech baby so that it's going to be head down to make for an easier delivery. And we use acupuncture only on specific points, only when the baby is full term, to move chi downwards. So that's going to help induce labor, to get things moving, to get things going faster. So postpartum support, 1 in 7 women are going to experience postpartum depression. Although this is just a label, but one cause can simply be sleep deprivation. People that use assisted reproductive technology for fertility can have a higher risk for postpartum depression. That's because the hormones that are used during ART disrupt the natural flow of the body's chemistry. So the key is to be patient and to build your body's strength back up. It just takes time. Most traditions give the mom one year to recover both mentally, physically, and emotionally. Diet and lifestyle tips for labor and delivery. Eating dates is going to help soften the cervix. Dates contain nutrients that have an oxytocin-like effect on the body, which can increase the sensitivity of the uterus. It also has a laxative effect, which can stimulate uterine contractions. And during delivery, during pregnancy, the abdominal muscles split apart. They need to be knit back together after the baby is born. Some activities that are going to be helpful to recover in the abdominal area: Pilates, also pelvic floor work, and belly dancing is really good exercise for that. The act of breastfeeding releases hormones that reduce the size of the uterus. So even if a mom is not wanting to breastfeed, using a breast pump can be beneficial to just help bring that the uterus back to a normal size. You can also promote lactation with acupuncture and herbal medicine. The key is to get your body's chi moving. If chi stagnates or isn't active, breast milk isn't going to flow. So good ways to move chi, of course, exercise, massage therapy, fire cupping, applying a warm compress to the breast tissue or to the back between the shoulder blades. Chinese herbal medicine, it's been used for thousands of years for lactation support and can be very effective and safe when when a specific formula is recommended by an herbalist. Since traditional Chinese medicine sees breast milk as an extension of blood, it's important to eat a diet with rich with blood nourishing foods and to stay hydrated. So, eating warm cooked foods is beneficial. Even something as simple as a hot cup of water is great because it relaxes your muscles and it helps move qi. Commonly used on the low abdomen to help with recovery is moxibustion, a castor oil pack. Um, Congee is a type of rice porridge. It's common in Asia, but it's very nourishing to the yin and body fluids. Using barley in place of rice for its medicinal properties can help increase breast milk supply. Using bone broth in place of water when you're making congee is good to boost nutrients. Also beneficial are going to be eating apricots, seaweed soup, and raspberry leaf tea is tonifying for the uterus. Moving on to our next topic about menopause. Menopause can start at age 35 to 50, and it can last from 2 to 10 years. About two-thirds of women experience symptoms when going through menopause. So hormonal changes are happening with estrogen and progesterone. Progesterone plays an important role in menopause. Progesterone helps maintain hormonal balance in relation to estrogen. During perimenopause, which is the period before the actual onset of menopause, your estrogen levels decline more rapidly than progesterone. So this imbalance can make for symptoms like hot flashes, mood swings, sleep disturbances, weight gain, and vaginal dryness. So adding progesterone can help restore this balance and relieve symptoms. Also, bone health. Menopause is the #1 cause for osteoporosis in women. Progesterone, along with estrogen, contribute to maintain bone density. During menopause, the decline in estrogen can lead to an increased bone loss. Progesterone can help support bone health and reduce the risk of fractures. Some red flags are going to be smoking, drinking excess amounts of alcohol or carbonated beverages, not exercising, a poor diet are going to make you more at risk for osteoporosis. And the most bone loss is going to happen in the first 5 years of menopause, where a woman can lose up to 3% of bone mass per year. And then the bone loss continues for the rest of the woman's life at a rate of 1 to 2% per year. So it's important to eat healthy, do weight-bearing exercise, avoid smoking, drinking alcohol and excess caffeine to keep your bones healthy and strong. So in TCM theory, the fundamental causes of menopause is what we call kidney yin deficiency. Acupuncture and herbs gently put hormones back into balance, addressing the root cause and thus relieving the branch symptoms. And post-menopause is 12 months after the last menstrual cycle. One red flag is going to be postmenopausal bleeding, and that always is going to indicate uterine cancer. So you want to see your OBGYN if you have that happening. So for diet and lifestyle recommendations, foods rich in phytoestrogens like soy products, flax seeds, carrots, and legumes. It can help alleviate hot flashes and other symptoms. These plant compounds mimic the effects of estrogen in the body. And foods to help with progesterone balance is spinach, avocado, walnuts. A TCM food therapy approach is going to be to nourish yin fluids. Yin nourishing foods are things like pork, watermelon, cucumber, tomato. Cooking methods that are really good are going to include soups, stews, broths, and stir fries. And avoiding dry cooking methods like frying and barbecuing. Exercise is going to be important, 30 minutes a day, 3 times a week. If you have low libido, testosterone containing foods are going to be good for you, like tuna, low fat milk, oysters, beef, beans, and shrimp. Hormone replacement therapy is an adjunct therapy often recommended by medical doctors. Premarin, in case if you did not know, Premarin is used in HRT. It actually comes from the urine of pregnant mares, but there are also alternatives to that for hormone replacement therapy. So there's bioidentical forms made from humans that have less side effects. And also there are compounding pharmacies. Taking fish oils are going to be good to prevent blood clotting if you're going to do hormone therapy. And if you're asking yourself, should I take hormone therapy? There's really a time and place for everything, including antibiotics. So the choice is really up to you. You just have to make sure that you educate yourself on all the side effects, dangers, and benefits of any therapy that you begin. Some helpful herbs and supplements for menopausal symptoms. Black haw. It's also great for menstrual cramps. It can help have a calming effect on the nervous system and help with hot flashes and mood swings. Magnesium, great, helps with the metabolism of calcium and vitamin D. Foods that are going to be good source of magnesium are leafy greens, nuts and seeds, legumes, whole grains, avocado, dark chocolate, banana, salmon, tofu, and dairy products. Manganese, not to be confused with magnesium. Manganese is involved with the formation and maintenance of healthy bones. It can help with this creation of your connective tissue and collagen, which you need for bone structure. Foods that contain manganese include pineapple, seafood, whole grains, nuts, legumes, rice, and leafy green vegetables, and also some varieties of tea, like oolong tea, black tea, and green tea. Vitamin E is beneficial as well. Licorice root is a harmonizing herb. It comes in different forms like tinctures, pills, raw herbal decoctions, but it should be used in caution for patients with high blood pressure. They should not take licorice root. Also, false unicorn root is another herb great for menopause. Maca is a South American root vegetable. It can help regulate the production and function of certain hormones such as estrogen and progesterone. AHCC, it's a mushroom blend. It's a dietary supplement made from the extract of several species of mushroom, including shiitake. It can help strengthen your immune system. It's also antioxidant, which just means it helps neutralize free radicals that can be harmful and reduces oxidative stress in the body. And also AHCC can help protect your liver from toxins and promote the regeneration of liver cells. All right, so next topic real quick is going to be weight loss and appetite control. So first question is, what's the cause of the weight gain? It can be anything, so many different things, hormones, toxins, congested lymph system, inefficient digestive system, So there's no one size fits all approach when it comes to unexplained weight gain. Um, Mosaic Diagnostics does lab testing that you can check for hormonal imbalance and also toxins. And what can be done? Basically, a starvation diet isn't going to help anything. It's not a very good approach. However, for some people, intermittent fasting can help. It's an eating pattern that involves cycling between periods of fasting and eating within specific time windows. Again, it's not suitable for everyone, but for some people, it works really great. Some benefits of intermittent fasting is it reduces inflammation in the body, improves insulin sensitivity, increases human growth hormone levels, which can support fat loss and muscle gain. Um, Acupuncture can help ear seeds. Injection therapy with lipo plus and B12 combination can boost your metabolism and energy. Some essential oils do help suppress appetite. Peppermint oil. It's just refreshing and invigorating. It can help curb cravings and promote a feeling of fullness. So, grapefruit oil is another one to uplift mood and boost energy, which can help reduce cravings and suppress appetite. Lemon oil, while it may not directly suppress appetite, it may help uplift your mood and support healthy eating habits. Ginger oil is warming and soothing, can help reduce cravings and support your digestive system. So those are just a few things that can help with the weight loss and appetite control. On my next topic, briefly, I'm going to talk a little bit about breast cancer. So risk factors can be anything from family history, nulliparty, which just means you've never been pregnant, never breastfeeding, early onset of menses, late onset of menopause can be risk factors. In TCM theory, cancers that occur above the diaphragm are linked to deep-seated emotional issues or not being able to let go of certain emotions. So the lesson to learn here is that resolving your emotional dilemmas and releasing them are going to be helpful for you. Detection methods for breast cancer, the number one detection method is going to be self-examination. What's also great is thermography and ultrasound because there's no radiation there. Mammograms have a lot of radiation. Mammograms are usually employed only after self-examination detects an issue, and mammograms are used just as something as a confirmation. I would recommend opting for thermography or ultrasound as opposed to mammogram for confirmation of suspected breast cancer. Chronic fatigue syndrome is something that affects some women. It's also known as post-viral fatigue syndrome. Some symptoms: debilitating fatigue lasting 6 months or more, and it doesn't originate from overexertion, and it's not relieved by resting. You'll have swollen lymph nodes, achy muscles, headaches, joint pain, depression, agitation, appetite loss or gain, and sleeping too much, brain fog, and your symptoms will worsen with exertion. So chronic fatigue is a problem that's better treated by Chinese medicine than by allopathic medicine or Western medicine because the cause is usually unknown. And TCM is really great at treating things that seem to be idiopathic or unknown causes. A trigger for chronic fatigue syndrome can be qi deficiency or low energy, kidney yin deficiency, spleen deficiency. and possible causes are emotional distress and unhealthy lifestyle. Mosaic Diagnostics does lab testing for organic acid. They have an organic acids test, and this takes a comprehensive metabolic snapshot of your overall health with 76 different markers, which can help us identify what's causing a chronic disease to occur. So we can get to like the root cause of something. All right. My last topic of this presentation, I'm going to talk about some natural anti-aging things that you can do. So from this approach, we look at it from beauty from the inside out. So taking care of yourself with good diet and exercise, managing your emotions, acupuncture treatments can help with slowing down the aging process. In Chinese medicine, emotions are the #1 cause of disease. So when you hold on to tension and negative emotions, that can manifest on your face as wrinkles or frown lines. Um, there are natural, non-toxic, and non-invasive ways to help yourself to look beautiful and to age gracefully. So one of the things that I use in clinic is what's called microneedling. So microneedling involves use of I use an AccuMicro pen, and it has 12 needles in the cartridge. They're tiny needles, and the pen cartridge oscillates at about 18,000 RPMs. So it creates tiny controlled microtraumas into the skin between 0.5 and 1.5 millimeters deep. So this is going to increase the product absorption into your skin by 2,000%, and it stimulates the production of collagen and elastin naturally. Areas treatable are going to be the face, the scalp, neck, chest, back of the hands, and areas of the body where you may have stretch marks. So it can treat acne scarring, age spots, large pores, dull skin, fine lines and wrinkles, and thinning hair. And sessions are done about once a month and are done 4 to 6 months. So there's just 12 hours of downtime after a treatment, and the results can really last 3 to 5 years. The serums that I use in microneedling include apple stem cells and hyaluronic acid. So what I use is Swiss apple stem cells, which can stimulate the regeneration and renewal of skin cells and has antioxidant properties. Hyaluronic acid helps with skin hydration and wrinkle reduction. It can have a plumping effect, filling in the lines, fine lines, wrinkles, creating a smoother complexion. I also use BioLight therapy. BioLight therapy, it's used in treating acne, fine lines and wrinkles, hyperpigmentation, male pattern baldness, female diffuse thinning hair, dandruff, and also speeds wound healing. It penetrates the skin up to 10 millimeters deep. It's a safe non-UV light that uses red, blue, and yellow LED light. So I use red LED light to rev up collagen synthesis, and it increases it by 200 to 300%. And the blue LED light treats cystic acne and can help clear fungal infections. I also use cosmetic acupuncture to improve your skin appearance. It helps to promote blood flow to the face, enhances your skin tone, texture, radiance, and also reduces fine lines and wrinkles. It stimulates collagen and elastin synthesis, and it helps relax the face muscles too. And it's also, I also use body points to help with overall balancing and stress reduction. And I also use with cosmetic acupuncture, I use nano needling. It's exfoliating just like a facial would be. It increases product absorption rate by 97%. It reduces pigmentation and increases cell turnover. Areas treated are the face, lips, and the area just around the eyes that the microneedling pen can't go near. The nano needling pen cartridge is good at getting around the eyes more closely. It's the same pen I use as microneedling, but instead of needles in the cartridge, it has 81 tiny silicone tips. They oscillate to separate the epidermis cells and really allows the serum applied to be well absorbed. So this can be done weekly with cosmetic acupuncture treatments in between monthly microneedling sessions. So some beauty enhancing diet and lifestyle tips. So gotu kola is really good for improving skin health. It helps to support collagen production, enhance wound healing, promote the health and appearance of the skin in general. So it can be great for things like scars, stretch marks, varicose veins, and cellulite. Collagen, as we all know, it's a protein, helps with healthy skin, hair, and nails. So collagen-rich foods like bone broth, fish, and egg whites are good. You can take a collagen supplement. Vitamin C is a really good, inexpensive anti-aging vitamin you can take. It helps with collagen synthesis and it's an antioxidant. So foods that include vitamin C in your diet, strawberries, citrus fruits, kiwi, bell pepper, broccoli, those can boost your vitamin C intake. Biotin. Biotin is also known as vitamin B7. It's great for a healthy hair, skin, and nails. Food sources of biotin are eggs, nuts, seeds, sweet potatoes, and avocados. Of course, staying hydrated is great for healthy skin. Coconut water is a really good hydrator. Probiotics help support gut health, which can indirectly impact your skin health. So foods like yogurt, kefir, sauerkraut, and kimchi are examples of probiotic-rich foods. And also very important is, are you getting enough sleep? Because when we sleep, our body heals and recovers, and we wake up feeling refreshed and are better able to handle stress when we get enough sleep. So that's very important. So this concludes my presentation. I want to thank you for joining me today if you're here live, and also for those who are watching later. I wanted to mention again, for everyone who's attending this webinar, I am offering my free ebooks. So I have ebooks on the various topics I mentioned today: menstrual disorders. There's one for menopause and natural anti-aging, pregnancy, labor, and postpartum. So I'll be emailing that out to everyone within the next week. I'll put an email together with the ebooks. And if you need help with any of the things mentioned today, please reach out to me. I'll be happy to help you. Visit my website, drlarasmith.com. I have monthly blog posts. I have a Facebook and Instagram. You can find me on social media at Dr. Lara Smith. And thank you again. Have a beautiful day. And if anyone has any questions, I'd be happy to answer questions at this time. All right. I don't think I have any questions on the chat. I'll go ahead and stop recording. But thank you for attending today again. Have a beautiful day. Oh, TCM is traditional Chinese medicine. Sorry, I mentioned it at the beginning of the presentation, but I used TCM just as an abbreviation in the later part of my presentation.